Netcare Medical Scheme 2016 Benefits and Contribution Presentation.
Netcare Medical Scheme 10 Golden Rules.
Familiarize yourself with the rules. Understand your rights and responsibilities. Obtain pre-authorization where necessary, even for follow-up visits. Remember, an authorization does not guarantee full settlement of any claim. Always make use of the designated service providers. If possible, negotiate better rates with service providers. Get screened for any health issues. Have any chronic conditions? Inquire about the scheme's treatment plans. Check your monthly member statement. If in doubt about anything, mail or phone the Netcare Medical Scheme Client Contact Center.
Website registration.
Visit www.netcaremedicalscheme.co.za to view the 2016 scheme rules, benefits and contributions, the treatment guidelines, forms required for administrative purposes, and an updated list of the designated service providers and preferred providers are published on the website. The Netcare Medical Scheme website has been specifically developed for the benefit of members, and by registering on the site, you are able to review your member statements, claims details, savings balance, and personal information online.
2016 Benefit Overview. Key changes for 2016 benefits. Limit increases.
Hearing aids from R14,300 to R15,160 per beneficiary per year every 2 years. Other appliances from R3,000 to R3,180 per beneficiary per annum. Prosthesis from R61,930 to R65,650 per beneficiary per annum. A sub-limit of R45,000 per beneficiary per annum applies to hip, knee and shoulder replacements. Radiology and dentistry limits increased by 6%.
Late joiner penalties.
Provision is made for late joiner penalties in the Medical Schemes Act to protect schemes from people who anti-select against the scheme by waiting until they are older to join and are hence more likely to need cover. The scheme will not impose a late joiner penalty under the following circumstances. The scheme will not apply a late joiner penalty to the main member, irrespective if they join within 30 days of employment or not. On the spouse, partner, adult or child of the main member, if the main member joins Netcare Medical Scheme with these dependents within 30 days of employment. This concession will, however, not apply to special dependents. This will in effect mean that late joiner penalties will be applied to all new applicants from the age of 35 not excluded in terms of the above concession, such as the spouse, partner, adult or child of the main member, if added at a later stage than when the main member joined. The spouse, partner, adult or child of the main member, if joining with the main member but where the main member did not join within 30 days of employment. Any special dependents, 35 years and older. Dependents will be penalized in age bands for the number of years they have not been on a medical scheme after the age of 21. Late joiner penalties are calculated as a percentage of the monthly contribution, excluding savings, applicable to the late joiner using the following formula. Age upon application minus 35 years plus years of previous cover equals total years uncovered. The following penalty bands, as specified in the Medical Schemes Act, will apply. The following example demonstrates how the contribution of a late joiner will be calculated. You want to add a dependent who is 50 years of age, and the last time the person was on a medical scheme was December 2011. This dependent can prove previous medical cover for a combined total period of 4 years. The scheme will calculate the late joiner penalty as follows. Age at application is 50 years, minus 35 years. This is the age from when the late joiner penalty will be applicable, plus the number of years for which the dependent proved previous cover, in this case 4 years. In this example, the dependent had no medical cover for 11 years. The penalty that will apply to this dependent is in the 5 to 14 years band, and a 25% penalty will be imposed. If the normal total contribution for this late joiner is R1,000 and 15% of that is allocated to savings, the late joiner penalty will be calculated as a percentage of the balance, which is referred to as the risk portion. The risk contribution of this dependent will thus be 25% more than the normal contribution. A late joiner penalty of R212 will thus be imposed, increasing the risk contribution from R850 to R1,062. The total risk contribution plus the savings contribution equals the late joiner total contribution of R1,212. It is therefore imperative to provide proof of membership for all previous schemes when applying to add adult dependents over the age of 35, effective from 1 January 2016, as this will affect the calculation of the late joiner penalty. Late joiner penalties will also not be imposed where a person was a member of a medical scheme prior to 1 April 2001 with no break in cover.
2016 Benefits in General.
Benefits and limits are subject to managed care rules and protocols. Non-emergency hospital admissions outside of a designated service provider will result in 25% co-payment. Hospital procedures are paid at 100% of Netcare medical scheme tariff. Procedures performed in the emergency department will be paid from savings unless in the case of an emergency. A R500 co-payment will apply for a colonoscopy and/or gastroscopy when utilizing a non-designated service provider. A R500 co-payment will apply to MRI, CT, PET and bone densitometry except for prescribed minimum benefits. Pre-authorization is required for IVP, tomography, contrast studies, MRI, bone densitometry, CT scans and mammograms. Failure to pre-authorize a specialist visit will result in payment from the member savings. Preferred provider use is recommended to avoid co-payments. Pre-authorization must be obtained for follow-up visits with a specialist. One optometry consultation per beneficiary per annum will be paid from the specialist benefit. One flu vaccination per beneficiary per annum will be paid from the risk benefit if obtained from a designated service provider pharmacy. The chronic medication benefit is only applicable to members and/or dependents registered on the chronic management program. Upon registration of the chronic conditions, the member will have access to a specific treatment plan. The treatment guidelines for chronic conditions can be viewed on the scheme's website. In-hospital dentistry is not paid from the unlimited hospital benefit, but from the annual family dentistry limit. All in and out of hospital dentistry is subject to dental managed care protocols limit. Pre-authorization is required for appliances and prostheses. Authorization is a clinical confirmation of benefit but not a guarantee of payment.
Membership.
Child dependents. Child contribution rates are applicable up to the age of 21. Students in full-time and part-time studies with valid registration documents will qualify for child contribution rates up to the age of 25. Proof of registration needs to be submitted annually to prevent the child dependent being charged adult rates. Child dependents turning 25 who are still studying do not qualify for child dependent rates. A child dependent turning 25 will be regarded as an adult dependent. In a case where a dependent is financially dependent on the main member, proof needs to be submitted. Adult dependents 25 years and older. A member needs to prove that an adult dependent is financially dependent on the main member. Change of personal contact details. HR divisions do not inform the scheme of any changes made to personal details. Therefore, any changes to member personal details should be submitted directly to the scheme.
2016 contribution increase.
The company subsidy will be communicated to members via their HR offices. The table reflects the annual contribution rate increase that will come into effect 1 March 2016. To prevent a delayed response, kindly utilize the correct contact details pertaining to your query. All the contact details are available on the scheme's website, the member brochure, and the pocket guide.